A body lift, also called a belt lipectomy, is an operation designed to remove all of the excess skin that occurs around the waist or around the belt area, and also to tighten up the abdominal wall muscles. This is an operation for patients who have had massive weight loss. Most commonly, those patients have also undergone a gastric bypass operation. In those patients, we assess them to make sure that their nutritional status is stable, that they've been at a stable weight for a period of months. Certainly, you don't want to operate on somebody when they've just finished losing that weight. And the operation involves an incision that will run all the way around the body in the area of their belt. The operation itself is done under general anesthesia. Can take anywhere from, say, 4 to 5 hours to complete the operation. In the posterior part of the body, over around the buttock area, we make this incision, and we tend to take the skin that is fallen down and we tend to pull it up. So in the posterior trunk, there's an elevation of the thigh and buttock skin, and the excess is removed from below. As we move around to the sides of the body, there's some tissue that's removed from above that incision, and again, a lot of the tissue is removed from below. We tend to pull and lift and do a thigh and buttock lift. All those things go together. When we come around to the anterior part of the body, around to the abdomen, then most of the removal of that skin is similar to an abdominoplasty or tummy tuck, where we make the incision, we lift up the skin, then we tighten those muscles again, and we pull the excess down and remove the excess. Again, it's a general anesthetic. I do encourage patients to spend one night in the hospital. However, we do have patients that have gone home following the surgery, either with a visiting nurse, with a family member who is familiar with the problems and able to take care of them at home. The recovery from the surgery, drains that we put in, drains we take out at 10 days to 2 weeks. Most patients at that point are really moving around pretty well. I would say for total energy levels to come back is probably a month to 6 weeks, but most of those patients, remarkably, as they've been through such a massive change with their weight loss, do very, very well, recover quickly, and enjoy the outcome of that operation. Again, there's certainly no amount of exercise that will allow them to remove that excess skin and tighten those muscles.